Morning, everybody. See how I command a room? Good morning, everyone. The Finance Committee will come to order, please. Thank you, everybody, for being here. Any citizens wishing to address? None. Thank you, JR. Item 3 is approval of the minutes. We had one modification caught by the none and only Dr. Chuck Weber. There was one item that referred to a February financials, and it's actually the June financials. So we'll make that modification. Leanne's got that information. So I'll entertain a motion on the minutes. Motion by Dr. Weber, seconded by Mr. Zimmerman. All in favor, please say aye. Opposed? Motion passes. Thank you. Moving on to the CFO report. Ms. Clark.
Good morning.
Good morning.
How are you?
We are good. Well, I am. I don't know about the rest of these folks.
Well, the main item I wanted to update you on was I did have the opportunity to present our fiscal year 2020 budget to the Commissioners Court last Tuesday this week. There were lots of questions, but I don't feel like there were any concerns about the budget that we presented to them as far as where we were. Now, they did not take a vote yesterday. That vote does not occur until the September 10th meeting, I believe, in a couple of weeks.
Correct.
So there will be more to come on that, but I was not asked for any follow-up at that meeting.
And I was in attendance, and our CFO did us proud, so thank you.
Thank you. All right, so if there's not any questions about that update, I've got several things that I'm going to be covering with you today, so just bear with me on the financials. We had a really good month for July. From a high-level viewpoint, admissions were very strong this month, as you can see with the blue bar there. I did want to point out on this page, we did have a favorable length of stay for the month. We've been working on length of stay for several months now, and you can see that beginning in May, we have trended down all the way through August. Our year-to-date is still slightly above, but we are having some favorable outcomes there. From an outpatient standpoint, our emergency visits were high this month for July. You can see, again, that kind of upward trend. There's a couple of reasons that is going above budget, and it mainly has to do with our redirection of a couple of patient flows. We have redirected a lot of the psych emergency room patients down to an assessment within the emergency department. So when I get to the psychiatric slides, you're going to see where those appear to be really low, but those patients are actually accessing services through the emergency department, whether it's prescription refills or an assessment where they are admitted up to the 10th floor in the PEC at a later time. Our primary care visits were favorable this month, along with our specialty visits. The specialty visits look really high, but it's more of a function of a lower budget based on the trend. If you look at the gray and beige bar as well as the blue bar, our specialty clinic visits were about equal to last month.
Sharon, before you move on, can you talk about the urgent care visits under the last 3 or 4 months? We're well below budget, so do you know what's driving that?
Urgent care was also kind of a patient flow change. We had traditionally seen a few more acute cases that were in urgent care, and now those are being directed also to the emergency department.
Okay.
So if a patient requires a CT, I believe they're getting transferred over to the main ED.
Yeah, higher acuity patients that they were hoping to get urgent care and be able to manage throughout, they're sending to the ED earlier to help that flow and shorten elective time.
Is it causing wait times in ED to back up a little? Or is it being reflected in that?
There are a lot of reasons that are causing wait times in the ED.
Can't
So
simplify
there
it,
is an
right?
end in sight with the ED. We've also changed some flows that happened within the actual ED over the last, 9 months. Those have been, kind of fluid. We will be opening up another 26 treatment rooms or treatment
Right.
spaces that will help with that flow. And those will also be staffed so people can be
Right.
seen a lot faster. If you remember from the budget presentation, we actually hope to see a decrease in the left without being seen rate, but we feel like most of those patients are being accommodated.
Got it. Does that address your question?
Same question. What's the tentative date for the 26th day?
I believe they're going to be available in October.
Wow,
Yeah, we're shooting October 1st. We're going to open it up.
very quick. Thank you.
You bet. Good question. Some of our other statistics, I always like to look at inpatient and outpatient surgeries. You can see also that these have been very strong, both. And we have, there's no trend line here, but for inpatient surgeries, we've really had a nice trend above budget all year. The red line is actually the budgeted expectation. Outpatient surgeries, we were below budget for about the first 6 months of the year, and then we've had a strong in outpatient surgery number for the last quarter. So these are our psychiatric statistics. So you see patient days were strong and above budget. Our clinic visits were also very strong. You can see there was also a process change here that increased those number of clinic visits because of the way that we are now setting an appointment before discharge with those patients that are either seen inpatient or through the PEC.
Got it.
Our psych emergency visits were strong this month and about equal to where they were last month. But you can see that they were slightly below the budget. For our days cash on hand, that remains about 207 or 208 based on the available cash. The difference between the first graph here and the second graph is that the second graph is all of our cash, which includes the restricted monies that we cannot get to for malpractice, and there's a couple of other small trust accounts, as well as the JPS Future Fund that we have board designated and set aside. So the first graph that represents the 208 over here is more what we have available for operations and to spend that have not been earmarked. If you wanted to go back and try to compare us to S&P or Moody's, then the second graph is the one that you would want to pick up for comparison. Our net AR days are continuing to decrease and decline. There's a lot of efforts to go back on some of the older accounts that we've had issues with. Rory's team is hyper-focused on some of the high-dollar older accounts. And when we look at the income statement, you're going to see part of the benefit of that.
Hey, Sharon, I have a question on that. On the high-dollar older accounts, can you see their full demographics of their ability to pay on that?
Yeah, and when I say older, these are typically insured accounts, either Medicare, Medicaid, or commercially insured.
Okay,
Yes.
thank you.
So we're working with the provider, the payer sources for those. Excuse me? So the question was, are these an appeal process? There's two big, yes. So for the older accounts, yes, and then we had one payer that had just a large delay that we've been working with, and we got kind of a settlement on a larger group of accounts with them. So kind of both. Our payer mix slide doesn't change a whole lot. As a reminder, our self-pay percentage is about 16%. Connection is about 21%. And the rest of those do have payer sources, and we do try to collect what we can for those that have insurance. Our JPS connection enrollment, this is a high for about a 2.5-year period. We haven't seen over 42,000 in quite a
Yeah.
while. Michelle Haynes and her team are extremely happy with these numbers, so.
So am I. We, Dorothy and I had an opportunity to talk a little bit before the meeting today about this chart and sort of the JPS connection enrollment, and I'll let her articulate her point better than I can, but basically it has to do with, is there ways we can break down some of the costs behind, I guess utilization costs is what you're looking for?
Utilization for that group.
So we have and we talked a little bit about this a couple of weeks ago during the budget presentation. This all is related to trying to manage and better manage the care behind the connection population. We are evaluating a software that we can bring in the costs that we have through our professional fees. Those are paid off of claims, and DT did kind of a deep drill into that system about 3 years ago. I think we can easily capture the outside medical services that are paid by patient. Our cost accounting is now able to assess the inpatient costs because those don't run through that same system and software. We are trying to figure out how to bring in the big open piece, which is our pharmacy. We have a really high outpatient pharmacy cost for these people, and we are trying to figure out with Maxor how to access their system and bring that in at a patient level. So that is one big open item. And I hope to, Michael Hochberg and I will be working on the implementation of that system, and then we'll be bringing back kind of a go-live schedule as you had requested a couple of weeks ago.
And that will include looking at their utilization in the ER and all, right?
Yes.
Okay.
Yes,
Yeah.
from a high level, there's two, in my mind, there's two populations that we really are managing without a payer source.
Mhm.
Those that have the connection program, and then those that are self-pay.
Right.
From the information that we have, our connection does behave a lot more like a managed population. They seek primary care, their ED utilization is lower, and so those two groups will still have to be looked at separately.
Okay.
But we
Yeah, I can
plan
see
to,
that.
we should have access to all of that.
Okay.
Okay, you'll keep us apprised of that as you're putting it together?
Yes,
Okay,
yes.
All right.
thank you.
Thank you.
We're in the final selection right now, and then, as you requested, we'll work through a schedule that would allow us to actually bring some information back to this committee.
All right, thank you.
Here's the income statement for this month. I did want to let you know, our bottom line, we were about $3.5 million ahead of budget this month. It was pretty much a break-even budget. The two main factors that are impacting us favorably is the net revenue line, which I talked to you about earlier when we were looking at days and accounts receivable. We were able to pick up a little bit with volume this month. You saw that our inpatient was high volume, as well as most of our outpatient indicators this month were above budget. So about a third of that was volume. We were negotiating and had gotten a large settlement from one payer of about a little over $1.5 million this month. We have been working on those, but those were older accounts that had been fully reserved, so that was a nice recovery. And then we also had an additional push on some of those high dollar accounts with payers, and we were able to collect about $1 million this month on those, and those were also highly reserved. So kudos to RepCycle. And then we also kind of scattered throughout here, we have variances again that are related to our pharmacy partner program. And that added about $600,000 onto the bottom line for this month. So that kind of explains the $3.5 million. If you look year to date, this is 10 months, so we still have 2 months to go. Medical Center is right at $24 million bottom line, about $18 million ahead of our budget. Again, a lot of that is volume, new programs that we started this year, as well as some large expense savings in both purchase services and medical supplies.
We don't anticipate anything in the next 2 months to significantly change this, do we?
Not that
Other than
would, not that significant. I mean, you know, I didn't preface, we still have 2 months and a lot of things can happen.
Right.
The one thing that always is an unknown is our formula funding from the state. We should know before we close our books, either late September or the first couple of weeks of August for both UC and DISH.
Right, those are
And
big
I do
variables.
we do have some entries that I'll be making before we close the books, but a lot of those offset for some of the one-time. We have about $1.5 million in tobacco that we received that was above budget, so I'll book that at the end of the year.
Okay.
And there's some other things, but nothing big and negative.
Right.
And the only big open item, I believe, is just the supplemental funding.
Right. Okay.
Acclaim also had a very strong month. They were about 2% ahead in their volumes. I think they're about 1% ahead year to date. And their net operating expense per encounter, I usually like to look at this not on a monthly basis, but year to date. And they are about 0.5% under in their cost per encounter that they had projected. So to me, that's a really good indicator based on volumes and total expenses, how they're doing on managing the bottom half of their income statement. Here's Mr. Montgomery's graph that you can't read it, and I think we can attribute that to more information is better than less information. So
Yep.
You're welcome to read through that, but that just gives you a good idea of our specialty groups and just who all we are employing.
Thank you, Dorothy.
So this is the income statement for Acclaim. Again, they performed better than budget. They ended the month at $1.7 million. A big part of that was some delays in hiring. We had some favorability in the salary area. And if you look year to date, it's pretty much the same variances. They've had a couple of one-time payments. Their quality incentive revenue is a little bit higher than they budgeted, which is obviously favorable for many different reasons. And they have, through the first 10 months, ended up about $3.3 million ahead of their budget. So when you add it all together, we have a combined income statement. For the month, we're at $2.2 million favorable compared to a budget of 1.9. And then if you look year to date, somebody shrunk that slide down so I could draw on it. It's $7.9 million as a combined entity. And again, that's really important. And throughout the budget 2020 process, we were able to preserve the favorable outcomes that we've had this year, and again, budgeted about a $12.8 million combined number for relativity.
Yep. Any questions for Sharon on these items? Yeah.
Okay.
Did you get your balance sheet to the judge?
I did get the balance sheet to
Thank
the
you.
judge. I got him one very quickly through July.
Thank you.
So he's satisfied there, I hope. I haven't heard any questions, so maybe that's what he needed. The next item on my agenda, do y'all need to vote on the
Yeah, yes, ma'am. Let
financials?
me entertain any questions for Sharon before we move to the next item. We have a recommendation from Dr. Weber, a second from Ms. Arizona. Yes. It said June, it should be July. I noticed that, yeah. Okay, so we have a motion on the table and a second. All in favor of accepting the presentation, vote aye. Opposed? We accept it. Thank you very much.
Okay.
Let's move to item B, please.
Item B is our annual vote on the defined benefit pension plan. You have 4 separate attachments within your books. They look similar to this. I'm not going to make you read those today. I try to go through all of these, and
Chuck read them. Chuck
I
read
s-
them. He's ready
Chuck,
to
you
kind of
read
give you
these?
analysis.
Dr. Weber? So pensions are complex, and there is something that we record on our income statement as expense. And then we have a totally separate and unrelated number for cash funding. Now, one impacts the other throughout the year, but the actuary issues 2 separate reports. The GASB is my financial reporting, and then there's another one that tells you what the funding request is for the year. And I don't know how to tie those better for you, so I just pull the relative numbers on the slide that I think are most of interest to a layperson that's not an actuary. The requested contribution for this year is going to be the $17.28 million number that you see in the blue. We had an employer contribution rate. All that is a percentage of payroll expense of the participants. So for the last 4 or 5 years, we have funded at 6.75% of participant payroll. Based on an actuarial recommendation, number one, because we have gotten to almost a fully funded status, and number two, we also increased last year at 10/1 of 18, a required 2% participant contribution from the 1%. So they felt very comfortable taking us to a 6.25% of participant payroll, which is, doing the simple math, is the $17.28 million. Other things that impact the funding and the earnings is the amortization period of 5 years. So all that means is if we continue to fund at the 6.25%, we would be fully funded in about 5 years. The number of participants is just over 5,600. Almost 3,900 of those are still employed and active in the plan, still making contributions. When you look at the financial viewpoint, if you looked at the income statement or on my balance sheet, a very complex calculation. We go through by participant, and they figure out how long these people are going to work, when the expected retirement age is, what their income level could potentially be, their 3-year average, and they come up with an actuarial liability of $297.8 million. We have market value of assets in our account of $292.6 million, and that makes the plan 98.2% funded or net position. So the 98.2% is the numbers that you typically see in the newspaper as people and reporters are talking about the condition of a plan. Many plans are below 60%, but ours is healthy and well-funded.
Yes, it is. Any questions?
I just think that's a point we need to always say, because we've all, this board's always made commitments.
Absolutely. So it's interesting, there's 5,600 participants, 3,900 active, and then a lot of folks that, maybe were here employed for a short time and left, but aren't retired, aren't drawing from it. So really, the number of retirees is pretty small.
It is. You have to, I'm not completely sure, but you do have to be a certain age to be able to access your
Right.
your plan without. So I think some people are able to access at 62, and then 65, you would get your full benefit.
Interesting.
So the active folks are the ones that are still either accruing benefits, participating, and/or have not accessed their retirement benefits.
Oh, that's included in it. Okay, got it.
Yes.
All right. Okay. Any, and your request today is the contribution for the FY19 of $17.2 million.
Correct.
Okay. Any questions for Sharon? Entertain a motion on that request. Motion by Mr. Powell, second by Mr. Nguyen. All in favor, please say aye. Opposed? Motion passes. Thank you, ma'am. Item C, we're going to move, we've got a, I'm sorry.
Because I'm a part of that plan, I need to exclude myself.
Okay. So please note that Ms. DeBose is abstaining.
I know they hired me when I was 5.
Ms. DeBose is recusing herself, correct? Not a no vote? Okay, just wanted to clarify that.
Yeah, I'm excusing myself.
Yes.
I'm a part of the plan.
Okay.
Okay.
Steve said that that was a no from you, and I was like, I just
No, I'm
want to
sorry.
clarify for the minutes.
Abstention.
Okay.
So item C, we're going to have a discussion about that in closed session and then come out and do the formal consideration of it, but we need to have a conversation about it first. So we're going to move to item D, and I think this is still you.
I'm here for a couple more. Let me back that up a little bit. So for item D, we are requesting the purchase of a property. If you recall, we purchased a large block of property last year that was a little bit closer towards downtown, right off of Main Street. There's also on page 130 of your handout, there's a plat drawing. And the piece of property that we are purchasing today is it's number 812. It is kind of in a red or a pink color, surrounded by all the yellow, right off of Bryan Street. So this completes a large block of contiguous property for JPS. Did everybody see the plat? Okay. It is for $238,000 that we can access capital budget funds from fiscal year 19.
And council advises me that this is market value and all that stuff's been vetted out, so.
Okay.
All right, any questions for Sharon? Entertainment, we have a motion by Dr. Weber, second by Mr. Zimmerman.
Great.
And all in favor, please say aye. Opposed? Motion passes. Thank you. Item E.
Item E is for a lease renewal of a piece of property. It is a small building that houses our IT and our EMR teams. They do some training there as well. It is it's kind of across Main Street from the foundation property on I believe that's the northwest corner. It's about 2,700 square feet, and we do have a 60-day out of this lease, but we can secure the property for a 3-year term at a monthly rent varying between $4,700 and $5,280 over the term.
We're there now, I'm sure.
We are there. We have leased that building for quite some time.
I thought we had the only comment is that 60-day out, everybody's concerned about when and if there's additional construction.
Yeah.
That might be on campus, but based on the fact we got the out and we've been there, we don't need to show up those individuals. I make a motion to
Okay, we have a motion by Mr. Powell.
Second.
Second by Ms. DeBose. All in favor, please say aye. Opposed? Motion passes. Thank you, Sharon. Mr. Skillens. Item F, insurance.
Got the same memo, didn't we? Good afternoon, good morning. This is our annual presentation for, make sure I get this up here, for our insurance renewal for the district. Before I begin, I did want to recognize a couple of people in the audience. This year, we changed our brokers for insurance. Many of you know we had Gallagher for the last 3 years. We went through an RFP process, as we are required to, and through the competitive process, we selected Aon. And as some of you may remember, Aon was our broker 3 years prior, and they had a great presentation. They have local offices here in Fort Worth, and also have MWBE representation as a part of this proposal presentation as well. So I did want to recognize Diana Stepp, Corinne, and Mike from Aon, right here.
Thank you very much.
Thank
Thank
you.
you.
And then, of course, our insurance consultant, Bob Duty, who we've had for a number of years, is here as well, and recognize Bob.
Thank you, Bob.
And then on my team, I would go back to the office and get kicked if I didn't recognize Lorena Hughes, who is our insurance and ERM director that coordinates all this.
Lorraine, you can kick him anyway, okay?
So we'll begin. This year was a bit of a challenging year from a renewal standpoint. As you saw in your materials, our premiums overall did go up, and that was driven by a couple of policies specifically, which I'll get into. Overall, though, we kept our incumbent insurers with exception of airport liability and the law enforcement coverages, but for the most part, all of our existing carriers are in place. Workers' comp, the good news in the insurance renewal this year is our workers' comp insurance went down, which is always good news. Not by much, but it did go down by a little over 3%, even though we had a payroll increase. So that was they did a good job in working that for us. Cyber liability. I know we've talked about cyber last couple of years, and we did a pretty good step up this year. So it's went from $10 million to $30 million. And where that $30 million came from is that Aon was able to show us peer averages for healthcare entities of our same size and complexity, and that showed that the $10 million that we had been covering was only in the first quartile, and that the average of our peers is about a little over $27 million. And given that, and given for those of you that are on the governance committee, when I want to talk about breaches and other kinds of challenges that healthcare entities face, we thought it would be prudent to at least get us to the average. And so that's where the $30 million came from. So it is an increase in premium as a result of the increased coverage, but even though we tripled our coverage, we did not triple our premium. The premium only went up by 121%. I use the word only lightly because I know it's still an increase. So the carrier for cyber is still the same. It's still Beasley, and it does provide us much greater coverage for our emerging risks. On D&O, directors and officers, and employment practices liability. So you'll see in the schedule in a minute that these are two separate policies that we combined them in the chart for ease of presentation, but they're both covered by AIG. That AIG has been our carrier for a while. And the reason for the increase primarily is that on the EPL side, is on the employment practices liability, overall with the increased number of sexual harassment claims across the country, mainly driven by the Me Too movement that you've seen in the paper, that insurance providers and carriers, because of the increased number of claims, have increasing the premiums resulting in this. And so it's not, if you're wondering why why this increased so much. It's not necessarily driven by increased number of claims JPS specifically had. It's really a national trend in terms of increasing the premium. And so just to give you a sense of the breakout between the two, the employment practices liabilities is about $123,000 of the $183 premium, and then the D&O is the remainder. So to give you a sense of that, I know Steve had that question as well.
Yep, thank you for that.
Yeah. And then regulatory liability. This is brand-new coverage, and it gives us a $10 million limit. So let me talk about this a little bit. So regulatory liability is not new coverage in the industry. It's relatively new. It's about 2 or 3 years old. We have looked at this in the last 3 years, but we have not really been satisfied with what we were able to get in prior years, mainly because, and being the compliance officer, I can speak to this more directly, is that if you have a False Claims Act or some other regulatory matter, many times they'll retroactively look at those issues 6 years. And so having a regulatory liability coverage that only is in effect on the date that it went into effect really wouldn't serve the entity really all that well if you had a claim, because you would have a look back. So this coverage gives us not only $10 million in coverage, but it has a 3-year retroactive feature to it. It's not the full 6, but if we maintain the coverage for 2 years, we'll have 6 years worth of coverage for those types of claims and liabilities. And so this would cover wrongful acts. It would cover errors and omissions related to billing and compliance issues. It would cover Stark and anti-kickback issues of any kind. It would cover commercial payer actions taken against JPS. It would cover any Medicare or Medicaid actions, RAC actions, legal and forensic costs associated with any of those, whistleblower cases, as well as voluntary self-disclosures. It's a very broad policy, and it's a very good one, and Aon did a good job in working with us to find the right carrier and the right coverage. And so I know in looking at it, it looks expensive, and I'm not going to say it's not. It's nearly $200,000 in premium. But I know in working with Diane and her team that this is our first year having this coverage. We're looking to work the premium down once they understand our compliance program and what the things that we do a little bit more in depth and have a little bit more history with us. So I'm proposing that we add this to our portfolio for those reasons, but I'm happy to take questions.
On the, I guess when it comes to regulatory for submitting claims and all that stuff, if our interpretation is incorrect and CMS come back and say that's fraud, does that still cover?
Well, it does cover wrongful acts, so usually errors and omissions. So if it's, if
But if it's against, for some unknown reason, right, it's the interpretation makes it out of compliance and against the law, does that still cover, or is it?
Yeah, that would be a False Claims Act type issue, because now if there is a difference, let me make sure I'm specific. There is a difference between intentional and unintentional. So errors and omissions, it would be unintentional, and so it would be, we made a mistake, we billed, let's say, Medicare, we got an overpayment, we didn't discover the overpayment until someone brought it to our attention, and then we had to pay it back. They may classify that on their end as a false claim and impose a penalty upon JPS. Those kinds of things would be covered. For wrongful acts that were intentional, that were known, and those kinds of things, those would kind of fall into a different category. I'm not sure, sitting here, whether those necessarily would be covered, but I can get back with you on that.
Can they answer that?
I don't know if they could answer, Dan, on that.
I want to get clarification on it. I don't believe it would for intentional acts, but we would like to clarify the policy.
But unintentional is covered.
Yes.
Okay.
Errors and
Just wanna make sure.
One thing you can add to that, Ron, possibly,
Yes.
is that the defense of such a claim would be covered. The actual payment would not be. So you would have at least defense coverage up through the point of that determination, that it was an intentional act.
Well, sometimes when you buy something, what you think is covered is not covered. What you think it should cover, it doesn't cover, it covers. So they can always hide behind, this is fraud or penalty and stuff like that, and may not pay. So
Right.
I just want to get clarification on that.
Yeah, no, that's a good question, and the general default is the false claim, even though it was an error and omission, but that's a good, we'll follow back up on that point. Let me touch on property now. Property is the most significant policy that we have, how it always has been, but now it's even more so. We have, our property rates have increased. I've talked about hail and wind here for every year, and that continues to be an issue, as you all know, in Texas. And
It only started when you started here.
Only-
I
yes,
don't know
that's what
why
I
it
said.
followed you here.
we only made claims when I started, right?
Right.
Yeah. And so all of the carriers that cover insureds in this region, Southwest region, including Texas, have increased their premiums. And as you recall, we had a per campus deductible to where you had a grouping of buildings that consisted of a campus, and then that would have a set fixed deductible. I think last year was $500,000. Well, we ran that out we squeezed that limit as far as we could, and they would not renew us with a per campus model. And so they went to a per building value, 2% per building. And obviously that would increase our deductible because you're looking at the values of each building, particularly here on main campus. And so, but I will say to Aon's credit that most of the other carriers were looking at a 3% or higher deductible per building. And so they did some good work to get it down to 2. And so that's the biggest change in terms of the deductible. They also, for other perils outside of wind and hail, so earthquake, flood, those kinds of things, those are on a flat fixed rate deductible. So those range between $100,000 and $250,000, depending upon what the peril is. But certainly the wind and hail deductible is the biggest change. From a terrorism standpoint, we've always had terrorism coverage offered through the government. The government has, since 9/11, has offered what's called TRIA, Terrorism Risk Insurance Act coverage. It has never paid out. TRIA coverage has never paid out because TRIA coverage requires an act of Congress to certify an act as terrorism in order for it to be paid out. And it has never paid out since 9/11. And actually, TRIA coverage is about to expire. Government is no longer going to offer that after next year. So we're forced to, as everyone else is, to get our own standalone terrorism coverage. And so Alpha Terrorism is the name of the policy that we have. We included it into property because that was from apples to apples standpoint. Terrorism was included last year as well. But Alpha Terrorism policy is a standalone policy, and it is gives us $300 million worth of coverage with a $100,000 deductible, and it does not require an act of Congress to designate something as terrorism, whether it be domestic or otherwise. And covers malicious acts, threats, and what you would normally think of. So.
And that's required. Terrorism piece is required coverage.
Well, it is extremely prudent to have. And I know Corinne, who's our property insurance person, is here. Would you say it's required, Corinne?
It's not a required purchase unless you have, some third party that requires you to purchase it.
Yeah.
Okay. That would be one I'd like to do without, but it's not my call, so.
Yeah. So that's the biggest reason for the increase there. So let's move on to the actual overall view of all the lines of coverage. So we talked about D&O and EPL, of the increase there. Crime is relatively flat. Fiduciary liability is flat. Cyber liability, we just talked about increasing from 10 to 30 million. Property, we just talked about. Aviation, which is our helipad. We don't, to my knowledge, own any JPS private planes, to my knowledge, but law enforcement liability is a slight increase, but relatively flat. Auto liability, I'll stop there briefly. For auto liability, this includes a brand-new mobile unit that Joel Hunt and his team will be using to serve the homeless. I think we've talked about this in other meetings, and so we are scheduled to take delivery of that here later this year, and that's very exciting for that practice. And so that mobile unit is included in our auto liability policy, which amounts to much of the increase, why you see an increase there. Underground storage tank liability, I know this one looks strange, going from $3,000 to $15,000. That was driven by an event that took place where we had a line that, basically there's 2 underground storage tanks. Both of them have diesel fuel in them. And one of our storage tanks, the line that went into a generator had a leak. So it did not, the tank itself was still intact. There was no leak in the tank, and there was no underground or EPA or environmental damage, from that. But there was a leak that was into the generator itself when the line splits out. We did disclose that to our carrier, and obviously, they factored that into their policy decision, and that put us into, unfortunately, a higher tier of insurance, even though the tank itself did not leak and it was not compromised. So, excess workers' comp, that was the good news story I told you about at the beginning. A slight decrease there. Volunteer is flat, resident malpractice is flat, general liability is flat, and then I spoke about regulatory liability. So that pretty much concludes the presentation. This last slide is just a visual of all of the lines of coverage and their related deductibles, but I'll stop there and happy to take any questions.
Any questions for Ron? No? Okay. I'll entertain a motion to accept his proposal for renewal on the insurance policies.
Move for approval.
Second.
Mr. Nguyen, second by Mr. Bose. All in favor, please say aye. Opposed? Motion passes. Thank you, Ron.
Appreciate it.
Ms. Baugh. Good morning.
How's everybody doing?
You're well.
Great. Thank you for allowing me the opportunity to present to you all. I have 4 contracts, 3 of which are outside medical service agreements. The first, and for the first contract is for outside medical services agreements with THR Health Resources. I don't need a clicker, okay. For those of you that, well, Amanda's not in here at the moment, but, we contract or have contracted with various entities when we are at capacity, over capacity in the Psych Emergency Center. And so this is a new contract that we started in May of this year with THR. They have 3 psychiatric hospitals, and so this contract is for all 3 of those hospitals. And you will notice that this contract is for 2 years rather than 1 year, and so it's a 2-year contract with a 1-year renewal. This was done in order to lock in rates for 2 to 3 years and also help with legal costs.
Okay. Any questions for Zelia on this item?
Move approval.
Motion by Mr. Bose, second by Dr. Weber. All in favor, please say aye.
Aye.
Opposed? Motion passes. Thank you, Zelia. Let's move to item H, please.
Yes, so this again is another professional service contract with Millwood Hospital. Again, this is the same as the THR contract. It's for 2 years with a 1-year auto renewal. And this, again, allows us an opportunity for overflow.
Yep. Any questions for Zelia on this item?
Move approval.
Motion by Mr. Bose, second by Mr. Powell. All in favor, please say aye.
Aye.
Opposed? Motion passes. And item I.
This is another professional services contract with Mesa Springs. This was a new one that we got in May and April of this year. And again, for the same scenario, 2 years with 1 auto renewal for a PEC overflow.
Okay. Any questions for Zelia?
Move approval.
Motion by Mr. Bose, second by Mr. Powell. All in favor, please say aye. Opposed? Motion passes.
Thank you.
Item J is still you.
Yes, this is the last contract for me for today. This is, we're requesting permission for sole source agreement on this contract. This is for corrections. I'm also over correctional health, and so this is for the Green Bay facility. This is a machine by Swiss Log. It's called a Talist machine. And what this machine does is it provides, it receives electronically orders from Maxor, our pharmacy, via our Epic EMR, and it dispenses and packages the medications for the inmates at that facility. The reason why it's a sole source is their technology that they utilize are the only technology that's compatible with Maxor and Epic EMR. This is a replacement system. The current system has been at Green Bay, which is also Swiss Log Talus, for over 6 years. The average life expectancy for a machine like this is about 5 years. And as a result, past the life expectancy, we are experiencing multiple breakdowns and things like that with this machine. And so we are requesting a replacement for it.
Budget.
It is in budget, yes.
Okay. Motion by Mr. Zimmerman for approval. Oh, this is a two-part. One is the exemption for
Sole.
sole source, and then the actual one too. And I think your motion contained both of those. So we have a motion by Mr. Zimmerman. Second, and a second by Dr. Weber. All in favor, please say aye.
Aye.
Opposed? Motion passes. Thank you, Zelia.
Thank y'all so much.
Thank you.
Mr. Carr. Morning, Kenny.
Morning.
I apologize if my voice gives out. I think I'm having the allergies
We understand.
completely. So I have two contracts for y'all to consider this morning. The first one is with Stryker Corporation. Stryker Corporation in this contract is for a lot of our OR equipment, primarily for the booms, which are the pieces of equipment that come down to allow the power as well as the anesthesia to easy access to our surgeons and our medical staff. It also allows us to have the ability to trade out pieces of equipment prior to the room being needed. It allows us to swap them out immediately rather than having to work on a repair and wait for a repair to occur. This is a 5-year agreement for about $4.6 million.
Any questions for Kenny on this item? All right, I entertain a motion.
Move approval.
Motion by Mr. Bose. Second by Mr. Zimmerman. All in favor, please say aye.
Aye.
Opposed? Motion passes.
Abstain.
And one abstention. Mr. Nguyen abstaining from that, please. Motion passes. All right, item L.
The next one. This is for your consideration. It's a company called Avanos. It's medical sales. What we get from Avanos is that we get FDA approved, we would refer to them as pain balls, and they're little small circular.
Did you say paintballs or paintballs?
Pain,
Okay, just making
P-A-I-N,
sure.
balls. And our pharmacy actually loads them up with pain medication, and they're either put in by our surgeons or anesthesia. And what it actually does for us is that it hits on one of our goals, is to reduce the number of opioids that we prescribe. And it also allows us to discharge our patients to go home where we know they're more comfortable and pain-free. And
Okay.
I'm open for any questions that you may have.
Any questions for Kenny on this item? Entertain a motion. Motion by Dr. Weber. Second by Mr. Bose. All in favor, please say aye. Opposed?
Abstain.
Motion, and one abstention from Mr. Nguyen. Motion passes. Thank you, Kenny.
Yes, sir. Thank y'all.
Mr. Mendenhall. Good morning, sir.
Morning.
I know, I like the tie.
You like the tie?
Yeah, it looks awesome.
I wore it just for you, and in fact, council and I, we dressed alike today, so.
There you go. You got,
So we
You
coordinated
got that
in the
going
check
for you.
shirt.
I
I
don't know if
think
it's good or bad, but
it's
anyway.
identical. I'm so sorry about that, Corey. So I have 3 contracts for your guys' consideration this morning. The first one is a contract between JPS and NetSync, which NetSync is a vendor we've done a lot of work. They're a great partner of ours that we've done work with. And this is for our distribution switches. What distribution switches are is in every one of our buildings, we have main network switches that we send all of our data through. They go out to our PCs, our wireless network, our printers, and all of our biomedical devices that are controlled by these. And these particular devices are about 8 years old. They have a useful life of 5, so we've been stretching that as long as we possibly can. So this first contract is with NetSync to replace those core switches.
all right, you've heard the description, and don't ask him any more about the switches, trust me on that.
Move approval.
We We have a motion by Mr. Bose. Second by Mr. Nguyen. All in favor, please say aye.
Aye.
Opposed, motion passes. All
The
right.
second contract is for our second phase of our virtual desktop infrastructure. We did our first phase earlier this year. It was very successful, and Dr. Schrader works with that particular technology in the ER every day. We've been able to successfully change the workflow on how quickly someone can log into a PC. If you think about when a nurse or a physician walks into a room and they have to log into all their applications, the amount of time that takes to be able to do that. And now all they have to do is take their badge and tap. And within about 3 to 4 seconds, where they were in the last room is now where they're at in this room. And they
cool
can
is
immediately
that?
pull that through so that they don't have to log into all those applications and restart those processes.
No spinning wheels?
No spinning wheels, exactly. So we did that with the pavilion as part of our FY18 capital. This is part of our FY19 capital to move that into the patient tower. And then our FY20 capital, which you guys have already taken a look at, will then start moving into the community health centers to do that same type of thing.
Excellent. All right, so you heard the
It's
no
like an efficient
spinning,
way to
the
do
no
it.
spinning wheels proposal?
Does it run to
Spinning
Bluetooth
wheels,
technology or
Bluetooth.
does it go to?
So
Bluetooth?
there are multiple radios on the Zero clients that we're putting out there. There's the radio for the Wi-Fi, there's a radio for Bluetooth, there's a radio for cell coverage as well, just as a backup, right? And so we're not doing anything on the cell right now. But those three radios are all in there. For the Bluetooth, what we're using that for is scanners and other things that are coming up. We're using NFC for this, not Bluetooth. So those are two different things. And we're using Imprivata to be able to do the NFC correlation from the device to the badge itself.
Awesome. All right, you've heard the description. Motion by Mr. Powell.
Make motion, including the budget anyway. Yep. Motion.
Powell, second by Mr. Nguyen. All in favor, please say aye. Opposed? Motion passes. All right, item O.
Thank you. And the third one is, I think, deserves a little bit more historical background. This third one is about data center services. Currently, we operate 2 data centers within JPS. One is in the basement of the hospital here. The second one is in Richardson, Texas, that you guys have seen contracts in the past with SunGuard Availability Systems, and we lease that space there. Over the last couple of years, we have had some fantastic environmental issues, and fantastic is the nicest word I can possibly use. It's very sarcastic. But we've had some issues environmentally with our data center here that has raised the temperature in that room from a constant 65 degrees to about 220 degrees in a matter of moments. And you can imagine the millions of dollars of infrastructure that we have in that data center that's here, that when it gets up to that temperature, things become critical.
Did your
And our
blood pressure
system-
go along up with
Yeah, our
that?
blood pressure goes up, and there have been times where we've had to take a crowbar and an axe to get into that data center to get the temperature back down to where it needs to go. Luckily, because we have redundant systems, patient care was never affected by that, but it's time for us to grow up and to move out of the data center that we have here. That environmentally will never be up to the code that we need it to be.
We got to get out of the basement.
Yeah, and we've taken Mr. Montgomery down to the basement to see him that.
It's right above the well,
It's
above the original
it's
well that
7
Mr.
feet
Smith
above
had
a
on
spring,
his property. Yeah.
is where our very highly sensitive electronic equipment is. And Mr. Nguyen and Mr. Montgomery, we've been talking about this for about 2 years now. I think about when the time is. We've done about 1.5 years worth of analysis to get to this point, and we've chosen through an RFP process an organization called QTS that has a data center up in Alliance, in the Alliance area by the Speedway. It's right beside the Facebook data center that's up there, to move the stuff that's in the infrastructure that's in the data center here up to there. And we'll hopefully begin doing that this fall and start moving that direction so we can get into a state-of-the-art data center as opposed to trying to invest in something that really is going to be a loss for us.
This is a slam dunk.
Yeah.
We got to do this. All right, any questions for David? I entertain a motion.
Move for approval.
Motion by Mr. Nguyen, a second by Mr. Zimmerman. All in favor, please say aye. Opposed? Motion passes. Thank you, David. All right. Legal counsel, Corey, what you got for us?
There were 44 contracts negotiated for the month of July that were under 500,000. I think those have been posted to the portal.
Any questions for Corey on any of that? Okay, we're going to reconvene in executive session briefly to talk about an item. We should pop out pretty quick, so thank you all. one of my copies. All right, Finance Committee will come back to order. We'll have Ms. Clark come up and talk about item C, 5C, relating to the GIBA.
Hi, I am requesting funding, our annual funding for the GIBA plan of $112,367.
Okay, you've heard the request. Any questions for Ms. Clark? Entertain a motion. Motion by Mr. Zimmerman, a second by Mr. Powell. All in favor, please say aye. Opposed? Motion passes. Thank you, Sharon. If there'll be no other business, then the Finance Committee is adjourned.